Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about the medicines that cannot be crushed. All medicines cannot be crushed. There are certain medicines that we should not crush, and those are modified release tablets. These are medicines that should be released slowly and steadily into our bloodstream or into our body, so this should not be crushed. Entry coated tablets, they have special coating on the tablets, are meant to dissolve in intestine and should not be crushed. Dissolvable, they dissolve in mouth and should not be crushed. Liquid filled gel capsule should not be crushed. Hazardous or irritant medicine should not be crushed. What happens when you crush this medicine? It can alter the rate of absorption. Remember, the modified release tablet, they release slowly into our body. So if you are crushing those medicine, this leads to release of large amount of medicine at a time. As a result, it can lead to fatal overdose. It also affects the stability of the medicine. These medicines, the modified release tablets, they release slowly. As a result, patient can take few doses in a day. But if you are crushing it, it affects the stability of the medicine. It can also increase the side effect and the irritant effect. Now let's see these medicine in detail. Modified release tablets are multiple types. Example, extended release. Extended release has the letters ER, XL or XR at the end of its name. Example, Toprol XL. This is metoprolol, it's a beta blocker. Another example is Procardia XL. It is nifedipine, it's a calcium channel blocker. So this releases the medicine over a long period, over an extended period of time. This is a broad term. Extended release can be two types. It can be sustained release and controlled release. Sustained release has the letters SR or SA at the end of its name. SR is sustained release, SA is sustained action. Example, isosorbide SR, it's a vasodilator. It releases the medicine over a long period of time. But the difference between sustained release and controlled release is that in controlled release, it releases the medicine at a constant rate, at a specific rate over a long period of time. Whereas in sustained release, it releases over a long period of time, but it does not control the rate. Whereas in controlled release, it releases the medicine at a specific or a constant rate. Now, controlled release has the letter CR or CD at the end of its name. Controlled release or controlled delay. Example, MS Contin. This is morphine controlled release and should not be crushed. Next is delayed release, which has the letters DR at the end of its name. This releases the medicine later after taking. So, any medicine with these letters at the end of its name, you should not crush those medicine. Next is entry coated tablets. Entry coated tablets has the letters EC at the end of its name. This has special coating, so it prevents the breakdown of medicine in the stomach, and these medicine are usually released in the intestine. Example, Ecotrin. This is entry coated aspirin. So when the aspirin is entry coated, it decreases the side effects like GI upset. Another example is diclofenac EC. This is diclofenac entry coated. This is best soluble in the intestine, so it needs to pass the stomach intact. Next is dissolvable. These medicines are supposed to dissolve in mouth. There can be two types. It can be ODT, orally disintegrating tablet, or it can be sublingual. Example for sublingual is nitroglycerin sublingual. You instruct the patient to keep this medicine under the tongue. It is absorbed, it dissolves, and it is absorbed faster. Now, ODT example is Sofran, orally disintegrating tablet. You instruct the patient to place the tablet on top of the tongue. It dissolves, and once it dissolves, it can be swallowed. But these medicines should not be crushed. It affects the rate of absorption. Next is liquid filled gel capsule. These capsules, if you crush or open it, again affect the rate of absorption. So you should not crush or open those capsules. Example, Thelcolax. There are hazardous or irritant medicine which you should not crush because it increases the side effect. Example, hormonal or chemo drugs. Example, methotrexate. Now remember, there is always exceptions. Some modified release tablets are scored. That means it can be divided. If the medicine is too big for the patient to take, it can be divided or halved. But again, this should not be crushed. Example, Toprol XL, that is metoprolol. So today we learned about medicines that cannot be crushed, and thanks for watching my video.